Getting a diagnosis of dermatomyositis is a little bit scary. People oftentimes are curious as to what's going to happen to them. They're really scared about the fact that they have a disease that is relatively uncommon and they don't know where to go and get information. So I think that one of the most important things that patients can end up doing is to make sure that they're educating themselves. And part of that doesn't mean that you have to go out and read every paper and become an expert or things like that. Partners and families are also a really important part of this entire process, because patients that end up having a chronic autoimmune disease like dermatomyositis really are in a situation where they need a lot of help, love, and support. So one of the key things that patient partners can end up doing is to try and just be there for their patients and for their loved ones, to be able to make sure that they're hearing their questions, giving them support, and giving them understanding to let them know that they're not in this fight by themselves. I think it's really important too to make sure that when you're a patient with dermatomyositis, that you're actually being an active member in your care plan. And part of that involves asking questions and making sure you understand why people are recommending what they're recommending. I think it's also important to make sure that you're making sure you're organized, and part of the way that people can help themselves and help their loved ones is to make sure that they understand what medications they're on, what medications that they should be taking, make sure that they're staying on top of their appointments and their testing and trying to help with some of those scheduling things, and to make sure that they're keeping a list of questions or concerns so that that way when they come to see their physicians or their other care team members, that they know what to ask about. It's really also important to make sure that you're taking notes as you go along, because otherwise it's really easy to get confused with everything that you have to deal with. I think it's also really important to realize that our job as physicians is to help educate and help care for people. So we're never going to be offended if someone asks the same question twice. We're never going to be upset if people ask questions about what other things that they might want to know about or what things they may want to look out for.